Airlines are facing some new rules for helping passengers with disabilities. The Department of Transportation now requires safe and dignified assistance, especially for wheelchair users. Airline staff must complete hands-on training by mid-next year, or mid-2026, that is. The changes aim to ensure faster, better service for disabled travelers. Going through labor can be tough for any expectant parent, but it can be especially challenging for Black mothers whose voices aren't always heard by hospital staff. As Dr. Malika Marshall reports, a program in Boston is trying to improve the labor and delivery experience for moms of color, one doula at a time.
At 35, Latoya Baskin was thrilled to be pregnant with her first child, Jason, but she had concerns about giving birth.
I've definitely heard and seen stories about how it's just harder, or just more, you have to advocate for yourself a little more as an African American.
We know that there are inequities or differences in the way that Black individuals or individuals of many different backgrounds either experience their labor and delivery care or their ultimate outcomes.
Dr. Allison Bryant is the Associate Chief Health Equity Officer for Mass General Brigham. She says having a doula or a professional support person can help decrease C-section rates, improve the patient experience, and promote breastfeeding. But they can be expensive. So Mass General Brigham started a program called Birth Partners, which pairs a doula with an expectant parent of color free of charge. Latoya was matched with Aisha Lee, who's been a doula in the Boston area for 30 years.
When I advocate, I'm advocating to the patient, not to the nurses. So I'm guiding her, telling her if she's not liking what's going on, how do you feel about that? I don't like this, I don't like this. Once she tells me what she don't like, I then guide her how to tell them what she doesn't like about it, so her voice is being heard. So how many ounces are you feeding them now?
Aisha met with Latoya before, during, and after delivery, and quickly became a member of her birthing team.
Another person in my village to help me along the way.
What are you doing, silly? Even if I haven't seen him in 3 months, when I step in the door and I start talking to him, they remember my voice.
The same voice that helped Latoya get the type of delivery she wanted.
The Birth Partners program now serves about 130 expectant moms every year. Could limiting sugar in childhood prevent health issues later? A new study shows kids with less sugar exposure from pregnancy through the early years face lower risk of diabetes and high blood pressure as adults. One expert's tip is to serve your kids their veggies first before they fill up on other foods.
Thinking a little bit about how we present the food, presenting it when they're hungry, giving them vegetables when they're hungry before dinner rather than after they've had pasta. That's an example of a way that we know data shows can make them eat more vegetables.
And she also says moderation with sugar in all foods is the best way to go. And next time you have the urge to go to the bathroom, you should listen to your body. Nerve receptors tell the brain it's time to go once the bladder is half full, but the brain also tells us to hold it until a socially acceptable time. Sometimes we do that for too long and get in the habit of ignoring our body's cues. That can increase your risk of a urinary tract infection and even kidney damage. Experts say holding it in for up to a few hours, a few times a week is likely not going to cause harm, though. And the Wisconsin Red Cross is offering up a Super Bowl trip. Right now, the agency is facing a seasonal drop in donations, and to help spur up some interest, if you donate blood between January 1st through the 26th, you'll be entered for a chance to win a free trip to the Super Bowl, a trip for two, that is.